Hello, welcome to our campus for the second in our series of legislative forums. These forums have been hosted at IU East by the East Region chapter of the IU Alumni Association for several years. Approximately 85% of our alumni have chosen to live and work in this region. These alumni, as well as this campus, are committed to open dialogue and collaboration for the betterment of the region and the state. I'm going to digress just for a second from my prepared script, because I want to mention to the fine people here from the community, some places are not having these forums. And the fact that our legislators want to share with you is important. It's important to have a civil discussion so that we understand. This is my 35th year in higher education. And for those of you who are trying to do the math, I was a child prodigy, And one of the things I've learned in my various leadership roles, we often strive to achieve consensus, which is challenging. I think what's more important that we understand. So if we understand why certain things happen or why they happen, it gives us a better sense of getting in front of things and so on, and not be quick to point fingers. Understanding is so important. So my goal today is that we have a forum, that we have a discussion, that we begin to understand why some of the things exist the way they do. There's lots of change happening, federal level, state level, local level. If we direct our energies in ways that we want everybody to agree, I think we miss out on the why. So let's have a civil discussion, whereas it's not accusatory, but one that we try to get an understanding of what's happening, because none of us are 100% correct in the answers, but if we get a better understanding of why things are going on, I think it'll benefit us all. So thank you for that digression there. I want to thank our Senator Raatz and Representative Barrett for joining us this morning. I am very grateful for the support they've given to IU East. Most recently, we had a student nominee for IU's Board of Trustees. It was the first time this institution had a student nominee to serve on that board. These two gentlemen were very supportive of our student nominee. I happen to have read the letter that Representative Barrett wrote, and I would like one of those letters for my portfolio. It was an outstanding letter. How powerful for one of our student nominees to have that kind of support at that level as a second-year student on this campus is outstanding. So I'm very appreciative of their support. I'm also very appreciative of our mayor. A couple of weeks ago, met with President Whitten of IU, saying great praises of the relationship that IU East has in this region and community. They asked me if I had scripted him. I did not. I did not. And I could not have written a better script than what he shared with President Whitten. I'm very appreciative of the relationship. I will continue to strive to enhance our partnerships throughout the community. So thank you, Mayor Oler, for that. I will have our moderator introduce some of our other guests. I would like to acknowledge our administration team here. Please stand. That's you, Brian and Ethan. One of the things I asked the cabinet to do is to get to know everyone on campus and in the community. So when you see these folks, you know who they are, and you can ask them questions about what is happening here at IU East. There's no transparency is very important. It comes with costs, right? But it's very important. So I appreciate the leadership team, and I've said enough. I want to introduce one of our distinguished faculty members, and you've seen them throughout the community, forums like this, Palette to Palette, a moderator, one of our finest professors, Minji Parker. And so I've said enough. I'm so happy to see you all. I'm looking forward to a really good discussion today. So thank you for your support. Dr. Parker. Thank you.
Thank you, Chancellor. Good morning. How's everybody doing? How's everybody doing? Everybody's, I know it's early, but thank you for coming out to participate in this legislative forum. We're always happy to have our representatives come and share their time with us to answer some questions and to bring some clarity and, like the Chancellor said, some better understanding to some of the things that are going on in the legislature. I'd also like to take this opportunity to identify any guests we have with us. I know Mayor Oler is with us. Thank you for coming out today. I thought Trustee Spears was going to be here, but I don't see her. Okay. And so the Chancellor has introduced our leadership team. Vice Chancellor for University Relations, Ken Chrisman, is with us. Brian Thomas, our Executive Vice Chancellor for Academic Affairs. If there's any other administrative members we have here that I don't recognize, I apologize. Okay, and the Chancellor has had a chance to introduce these people as well. So what I'd like to do is to get started, we're going to use our normal format. We're going to have our legislators give us a couple of minutes updates each on what they're doing in the legislature right now. At that time, we're going to open up for questions. We have a slightly different format because we're in a different venue. And it's important to note that we have to be out of this venue by 9:15 because there's another group of students. We're hosting a group of 350 students, high school students on campus, which is actually just another day here at IU East for us. We do a lot of these different presentations for high school groups and other community members, but we're gonna have to be out of this space around 9:15, so we're gonna have to finish up around 9. But what we're gonna try to do is make sure we have time for questions from as many people as possible. So what we've done this time is we've set up microphones in the aisles here. So if you have a question, when we open up for question and answer, please come up to the microphone and we'll take you in turn. Each person will have 1 minute to ask their question, and I'm asking that we keep it to one question per audience member so we give time for other people, because we also have to have time for our legislators to answer your question. So I'll give you a hint when you're about halfway through your time, and then I'll give you a bigger hint when your time is up, okay? All right. So having said that, let's get started with giving Representative Barrett and Senator Raatz an opportunity to just give us a quick update on the things that are going on in their ward. Representative Barrett.
Thanks, Dr. Parker, and thanks to the Chancellor. Excuse me. We always feel very welcome on this campus, and it's a nice opportunity for us to kind of update the community on what's going on. So we're probably 3/4 of the way done or so, maybe 80%. I think we have to be done by April 29th by statute. So that leaves us about 10 or 12 days, but there's still really a lot going on. We're done with the committee section. We're on the second half. So the Senate bills are now being vetted in the House and vice versa. And we've finished the committee session and gone into now finalizing second and third readings. The last 2 weeks of the session is really quite chaotic. I love the first part of the session where we vet things in committee, we hear testimony, we take things to the floor and further amend the bills and then vote on them. At this last part, we do these conference committees that it's just very chaotic. There's not as much transparency in the system. There's not as much time. There's really an urgency at the end. But I can tell you, up at this point, it seems like a lot of the things that we're hearing in the House now that came from the Senate, there's agreement, and there hasn't been a ton of conflict that have required this last step. The things that I probably spend 80 to 90% of my time in the healthcare arena. And this year I carried one of the House Republican agenda bills in healthcare, and it's largely a patient protection bill. It's largely access to information, access to the medical records, expanding the right to try investigational treatments, the protections of the medical record, pricing transparency. You know, there's a new tool that's out now that I don't know if anyone's used, but it's called the All Payer Claims Database. And it's data from payers that goes into a central depository, Department of Insurance, and then it's collated and accessible. And so if you have a CAT scan ordered, you can look on this portal and look at your insurance and find out where you can get that done at the most reasonable price. And we're trying to build that out a little bit. We're dealing with the high cost of healthcare. You know, this community is super fortunate. You know, we have a great independent hospital. In addition, we have a campus that has unbelievable health training programs, great nursing programs, IU East and Ivy Tech. And we've done a lot of legislation over the last 3 years to help that pipeline. One of the big issues is the shortage of workers in this space. It's probably multifactorial. It's the age of the population. It's the high demand on the healthcare arena. It's the commitment to that workforce that's important. And so to have the facilities that we have on this campus is a true blessing. But the cost of healthcare is just skyrocketed, and it's gone at a pace that's not sustainable. And so, you know, we're trying to unwind it. It's incredibly complicated. In this community, probably 75 to 80% of the patients that we take care of in this hospital are either on Medicare or Medicaid. And that means those are government payers. They're set rate at arguable at what payment rate they pay. But when I was in practice, Medicaid paid about 20 cents on the dollar to what private insurance would pay, and Medicare paid about 25 to 30 cents on the dollar. And so what's happening is we're placing this burden then on commercial insurance to make up that difference or that gap. So we're looking at things we respect the care that's occurring in our communities, particularly in rural communities, and trying to advocate for that. But by the same token, we can't have a price structure that's such that it discourages small businesses from coming in, because the method for healthcare in this country is provided by the employer. And so we're trying to find a landing spot, and we deal with the hospitals constantly. Or, you know, I do. Our own hospital comes to the State House 3-4 times a session to communicate with us and to interact and to let us know what their concerns are. I meet with the Indiana Hospital Association about every day. So it's a huge issue. Our Medicaid program. the spend in our Medicaid program was unsustainable. The curve, and the Kaiser Family Foundation has looked at these numbers nationwide. And what happened with COVID was, well, there was a lot of illness with the pandemic. There was a lot of stress. The Medicaid rolls just blossomed. Ours doubled in terms of the Medicaid expansion. And so the issue was that that was unsustainable. So we're looking at mechanisms to how can we help people get back into the workforce? How can we help people land on their feet and be self-sufficient? And so we're looking at revisions to that program. I deal a lot with the Department of Health and with FSSA, had 2 of their agency bills. And that pretty much is the summary of how my typical day and my legislative duties are over there.
Thank you. Senator Raatz?
Sure. Thank you. Good morning, everybody. Unlike Representative Barrett, I spend about 85–90% of my time in education, mostly in the K-12 space, some in higher ed. We don't really get that much involved in higher ed, essentially. A lot of funding, but not a lot of dictatorial guidelines and what needs to be done, because it's really just past that point. Students are choosing what they want to do, and you guys are educating them. And so our job is to set the stage for them so that they can be successful when they get past the K-12 space. And, as Representative Barrett said, none of this is easy, right? Because if we say we need some additional outcomes, some better outcomes in the state, then we set some guidelines, and it's hard out on the ground. Folks have to change if we do something, and change is never easy, generally speaking, especially when there's about 65,000 teachers in the state and 1.1 million students in the K-12 space. And so it can be very interesting when we look at change to try and get better outcomes. And that's what we're extremely focused on, is making sure that we're getting better outcomes in the state. And as Representative Barrett mentioned, even the concept of teachers, how we're in a lot of professions, we're struggling to get people in the profession. We can say, well, the teaching profession doesn't pay much, or maybe in doctors. Actually, we had a bill this year that created a scholarship for prosecuting attorneys, so that and we did this similarly several years ago in the teacher space, where the state would pay X amount of money for, in the teacher's case, it would be $10,000 a year for 4 years, get a bachelor's degree. And then you had a 5-year payback. You had to work in the state as a teacher, and that would eliminate the debt. And if anything else in between, if you quit after a couple of years because you didn't like it, then there'd be pro rata payment back for those extra 3 years. And so when we passed that bill probably 4 years ago, in fact, Brian Bosma was the speaker at the time, so it's probably been 5 years. I thought to myself, and actually said in the committee hearing, that how long before the next profession comes that says we need to have one of these for X, because we're struggling, I think as a nation, not just Indiana or East Central Indiana, but as a nation in a lot of ways. And so at any rate, that popped up this year, and I figured that it would as things went on. So we've been doing our level best, the state level, to make sure that we have enough teachers and the qualified teachers as well. And so I know some of that is done right here on this campus, and we're grateful for that. I talk to your dean often. Haven't seen him for a while, but always talking about the number of teachers are coming out, and some of the things that we can do at the state level to assist it in that as well. So that's kind of a brief overview. Some of the things I'm very proud of in education, and had some testimony from right here in Wayne County. We went to mandate, which is not very easy to do from the state level, and it's not something we do often, but especially in the education space, but require the science of reading actually be taught, and then some professional development to get the profession up to grade, and we've seen some tremendous results right off the bat. So there's it's biannual. So every 2 years, there's a state's report card taken, or nation's report card, they call it, taken. So randomly sampled numbers of students in every state. They take a random, and that's not a random test, but random students take the test and then compare it across the United States. Indiana was number 19 the last time it was taken. We moved up to number 6 in 4th and 8th grade reading. And so I'm incredibly proud of that and excited that it's happening on the ground, because if we're going to, for the future of this nation, the future of this state, the future of this county, we have to have educated folks. And so we're doing our best at the state level, even though some of these things are very difficult. We're pushing, and now we're looking at math outcomes as well. So I'm proud of that work. And initially there was a lot of pushback, but I can give you a testimony from right here in Richmond that some teachers, this was just 2 weeks ago in one of our school districts, where they embraced it so much because they seen the outcomes in some of the students, and so now they're collaborating. The teachers are excited about it, and they're coming together and collaborating on how we can continue to move this thing forward. So some really good things are happening there. Probably the most exciting thing for me this session, one of the bills I have that got sent to me from the House, was a priority bill there, which was deregulation in the K-12 space. And so a lot of May provisions and other things. It's 150-page bill that goes across the board. And so we've been tweaking that. I just about got that thing ready to go across the finish line. We spent about an hour or so on the floor on that bill yesterday. And so I'm excited about that, the dereg piece as well. So there's some good things happening, not without issue. Property tax reform is on the table, and we've been collaborating back and forth. And so we're hearing a lot from the counties and schools across the state. And so you can bet your commissioners and council people and mayor here in Wayne County has been after both Representative Barrett and I to make sure that we don't cut things too far where it causes the issue to function. And so I think we've landed at a good spot. It's hard to go across all those numbers, but very difficult thing, because we heard a lot of an outcry that in the residential space, your property taxes keep going up. And then balancing that with the inflation for everything has gone up. How do we balance that, give some reprieve, but make sure that the cities, towns, and counties still have the ability to provide the services that we're all accustomed to? And so that's not been the prettiest thing, and I'm not sure we're quite there yet, but we're still working on it, and a lot of collaboration going on. So that's basically where we stand at the moment.
Okay, thank you. So now we'll open up for questions from the audience. If you have a question, would you please come to one of the microphones? If you have a challenge, a mobility challenge, if you just raise your hand, we'll have someone bring a microphone to you. So either raise your hand, or if you'd like to, stand up at one of the mics and we'll get started. I see a few people moving toward the microphone, so just...
Thanks for being here today. You mentioned, Jeff, the property tax issue. That was made a big thing in the campaign this last year. We've heard all kinds of things about the impact on local government. I'm concerned about this property tax issue from two standpoints. I'm a farmer, so we've had huge increases in assessed valuation of farmland over the last 3 years. But I'm also concerned from a local government standpoint of, are we going to cut the property taxes and in the process bankrupt the local government? And that's been a real concern of mine. So I would appreciate if you could just kind of give a little update of where we're at on that. I know there was a agreement supposedly yesterday on property tax. And then a specific thing to Brad is, we in this county have a major issue on health-related issues. The funding was really increased last year for that. It has been talked about really decreasing that this year. So where are we at?
Thanks, Max. So you bring interesting perspective in that you're both a landowner and a homeowner and in local government. So you see the challenges on both sides. So the whole thing is price of eggs has gone up. The wages for a firefighter have gone up, and as local government, I don't know if people realize 100% of property tax revenue stays locally. And in Indiana, we use it for our infrastructure, for our schools, for our public safety, amongst other things, but it's all local dollars. And so it's a real challenge to make a decision on the state level. It's going to have local impact. But, you know, everyone in this room wants to pay less in terms of their tax. So we're trying to find the sweet spot. We're trying to find the benefit of property tax is that it's a stable basis year after year after year after year. And somebody owns the property, somebody's paying the taxes. And so you can bond on that. You can provide public safety on that. So anything that alters that, there are states that don't have property taxes, but they have sales tax or state income tax. You go to our neighbors in Illinois, somebody in the Senate referenced the other day that their property tax is 5 to 6 times what we pay in Indiana. We have caps at 1% for residential, and then separate formulas for farmland and all that. So, I mean, what we've been trying to do is find some relief. The issue is the inflationary increase in our home values. And that's great when you're going to sell, but if you're going to live in that home for, 30, 40 years, or you've been in that home for 30, 40 years, how do we dampen that curve and yet still maintain funding? So it's on our side right now, and we've done some things. They include tax credits, homestead deductions, flattening the curves. We're trying to, I doubt many people really understand the whole system with levies, local levies, and income tax rates, and it's convoluted now. So what we're trying to do in a really short time is provide relief. Now, that said, everyone's going to get a property tax bill or has gotten a bill that's due in May, and that will not be impacted, nor will the next one in the fall. But these things then will kick in. So currently what we're doing is we're running pro formas and spreadsheets, and we've come up for all the units of government in this area in the Wayne County. I shared some of these numbers yesterday with Max and showed what the impact is on our local government, and it's sustainable. I mean, I think our local government's done a remarkable job in being balancing their budgets and being fiscally responsible. And I was afraid that there would be some penalty to some counties, municipalities that operated that way, but it does not look like that's the same. Now, my guess is in the next 2 weeks, there are multiple runs on this that we're trying to figure out. How do we get our veterans tax relief? How do we get those that are age 65 tax relief? Your other question was on that Health First Indiana plan. So this was came out of the governor's public health council, and we built out a program that had guardrails and parameters. Initially, on the heels of COVID, we weren't sure what the buy-in was going to be, county by county. The initial offering, 86 counties opted in. Now every single county is opted in. It's the first time the state has invested in public health, and the initial funding was supposed to go from $100 million each year in the biennium to $150, and that's been all over the board. But every day I'm advocating for maintenance of that. I think our county has been a model county. We didn't build out infrastructure. We didn't increase our workforce. We partnered with existing not-for-profits, with existing hospitals, with the existing structure of our community, and I hear nothing but good things about it. So we'll continue to advocate for that.
Okay, I'll start there and go backwards. Yeah, so I'll start with local health solids. We had heard some reports know that some were utilizing some of those funding mechanisms to do things that you're already doing, like going out and inspecting restaurants. And that's where we're in the Senate, we're talking about drawing a few deeper lines in the sand and how it's utilized, because if we're going to take your tax dollars, what the effort is to try and have impact health at the local level and spend some tax dollars to do that, to prevent from having larger issues as we go on in life. That's what we're, like smoking cessation, or maybe diets, so we don't end up or are able to get off of diabetes medication, things along those lines. Some efforts that way. You guys understand that, just for everybody else. But making sure that it's being utilized properly is the only complaint that I have, and that may be singularly in the state, but it certainly came up multiple times in the last committee hearing that I had or appropriations, and we looked at those local dollars. And so that certainly will be it's continued, and we'll continue to do that, just making sure that how you measure efficacy is not very easy when you deal with human beings. And so we want to make sure that we're getting a return as well. So the property tax issue, we're still, as Representative Barrett said, we're wading into that thing. I'd say we're probably chest deep in it before we get to the top and figure out where this whole thing lands. And you all have been, everybody in this room has been advocated for very well, not only by the county, by the city, and others in the county, from towns as well, looking at this effort, trying to make sure that what we do is fair, I guess, if I could use that word, because we start talking about these things. And as I mentioned earlier, when we talk about the cost of your property tax, the same thing happens when we talk about the cost of all the services that are provided in the community. The cost of wages went up, the cost of materials went up. Everything is incredibly more expensive than what it was. And so how we balance that thing out, make sure that we're still providing the services, and give some relief. This is walking a tightrope by every sense of the word. And so I think we're getting close, but the first iteration came out of the Senate, Senate Bill 1. The House put their fingerprints on it. Now we're at the negotiating table, and we'll be there until the 25th. I think we're going to be done, as our hopes. So we got another 2 weeks before we're complete. And all I can say is your local representatives have been on the phone continually, and that's okay, because that's where we get our best information from.
Okay, thank you. Let's take our next question here.
Hi, my question is about healthcare. Representative Barrett, you stated that, healthcare costs and insurance should be private, that the people who are working should be paying for their insurance instead of it coming from the state. However, in the state of Indiana, we still run on a 7.25 minimum wage. You cannot afford insurance in the state of Indiana, even if you are working. I just got a job working 30 hours a week. It was the best I could do. They want me to pay $188 a week for the minimum insurance available to me. That's going to take half of my paycheck every week. How is that sustainable? And when are you going to hold businesses accountable for paying their fair share?
That's a great question. I mean, it's a very fair question. I mean, so with Obamacare, we tried to do two things. One, give the state responsibility for covering at poverty limits and up, and then to create this build out. And I don't know if you've looked into that. Not everybody that works can buy into their employer's insurance. So there are the marketplace products that are out there. Now, sometimes those won't give you the coverage limits that you get through a private insurance, but it's an issue. And I think the average wage in Indiana far exceeds what the minimal wage is. But to your point, I appreciate that that's a problem.
Senator Raatz.
I can't add anything additional to what Representative Barrett said. I agree across the state of Indiana, the minimum, we don't want to use the word minimum wage, but what's being paid as the minimum wage is higher than that for sure. Some areas probably not, and as your testimony goes, it's not necessarily here. If you look at the history of the whole system of medical care and how it was paid for, we go back to the beginning, that the hospitals are set up as nonprofits, and generally speaking, back in the day, the local governments would subsidize health care at that level, and somehow we made it work. But there are a lot of factors at play in health care. The number of those who are on Medicaid, what the state has to pay as a portion of that, and all the advances and the expense of doing that is very difficult as well. So how we balance this thing is not easy for anybody. I said in a committee hearing yesterday, we in East Central Indiana cannot function without Reed Hospital. Reed Hospital, as Representative Barrett mentioned, 3 times I've had lunch with those guys and talking about how we can help them reduce the healthcare costs or Medicaid reimbursement, Medicaid reimbursement rates. And it is so multifaceted. Thank God for Representative Barrett having been in that space and understand it at depths. Most people don't understand it. That's the beauty of a part-time legislature.
Okay, thank you. Next question.
Jumping backward to the first comment, I am a taxpayer, 40 years plus owning my home senior. I do not need tax relief. I need good funding for public schools. I need good funding for public services. So it's not 100% of us that say we need tax relief. I want a wise spending of our taxes, which then leads me to my primary question, and that is on the issue of climate change and specific bills in front of the Senate and the House right now. Look at the weather the last few weeks. We can see the problems. I'm particularly concerned about classifying natural gas as a clean source, cleaner than some, true, but it is not carbon-free. Concerned about prioritizing oil, gas, and nuclear in siting. That's Senate Bill 425, which disadvantages renewables such as solar and wind. Again, solar tax credits for biofuels, which are highly energy inefficient. I'd like to hear your positions also on small nuclear reactors.
I'd support the EPA support small nuclear reactors as that industry expands and we get more information and move forward. But that's myself. I'm supporting that and will continue to support that. When we look at the cost of solar and the cost of wind, one thing that no one talks about, and that's the government subsidies that go into that to make it even viable. And so I'm absolutely agree that we need to be cognizant of our environment. But what we can't do is we have to balance that whole thing. We can't ruin the economy in the midst of it, so we can't pay Medicare. We wreck the economy if we went all the way in one direction. So we're trying to balance this thing, look off into the future. Is natural gas one of the things that we can use to get there? I say yes. And so that's my stance on it. We got to balance this thing out. And so had a long conversation, not a long one, a short conversation last night in Indianapolis on small modular reactors. And that as that industry proliferates, I want Indiana to be in the front end of it. That's my.
Yeah, I feel like we have a responsibility that when you walk into your home, that you can turn your lights on, and that our businesses have power, and you know, I think a multifaceted approach is responsible. I mean, I think we're certainly seeing more solar fields in this community. I can look out my bedroom window and see a solar field now. I don't think it's doing much today, but that's the problem. So I think it's our responsibility to have the infrastructure so that we can provide power, so that there's no rationing of power, there are no brownouts for power, that there is a combination of every modality that's available to us. And in terms of the nuclear modular reactors, I think the future is there. I mean, it's an 8 to 10 year process from what I understand. There's nothing that's going to happen tomorrow in that regard, but to me, that's one more of the tools in your toolbox when it comes to making sure there's reliable, affordable power for every Hoosier in the state.
Thank you. I do support nuclear. I agree with you on that. I disagree with asking taxpayers to pay the development.
Okay,
Well, yeah, that's good. Go ahead.
okay, thank you. Next question.
Sure. Good morning, folks. My name is Jimmy Freiberger, a lifelong Hoosier and Medicaid recipient, and I have with me today 3 things. 1 is the bill. 2 is some lottery tickets. Now, I'm going to put these away actually real quick because according to the bill, y'all are partnering with the State Lottery Commission and Indiana Gaming Commission to make sure us pesky poor folks aren't making too much from gambling winnings to unqualify for Medicaid. Now, the third thing I have is this notice that I've been cut off of HIP recently. Now, I've been booted for failing to verify a couple of things I didn't receive prior notice for. In my experience doing community work, particularly around housing, going door by door, talking to folks in our community who will be most impacted by the Medicaid bill, getting booted off support programs we rely on to make ends meet because somebody sent the mail a month late is a tale as old as time, as well as the constant mistakes that are made by government officials in filing our paperwork. Mistakes that are going to increase tenfold with the new incessant and expensive also paperwork demands that are coming out of this bill, and that these mistakes have the costs of the people's health, in worst case scenario, their lives. I have spoken with people who have medications that without HIP to support them, they would be unable to afford them, they would die, and for them this bill is the guillotine. So then my question is, why is it that we the people have to shoulder the burden of a crumbling bureaucracy that will be made worse with this bill's excessive requirements, and how can you justify any intervention in our healthcare system which concerns life and death during this crisis?
You're over time.
Yes.
Thank you.
So, yeah, Jimmy, I can respond to that because I've been working on that process. So, the bottom line, the premise of that bill is that the sustainability, someone's paying for that program. The sustainability, the spend in that space is not sustainable. And so what we're looking at is how do we as a state can't develop $1 trillion deficit like our U.S. government. We as a state have chosen not to have a deficit like states such as California. I think $63 billion deficit. So we have a responsibility to use taxpayer dollars to support the state. And that Medicaid program was not going to be around in 8 to 10 years if we didn't act and do something. And so now realize there's two pieces to that Medicaid program. One is care for the needy. The other is the Medicaid expansion for the able-bodied adult age 18 to 64. And in that category, it's income-based. So if you win $30,000 at the racetrack and that income is spread out over a 12-month period of time, it may disqualify you from Medicaid. If you are gifted money, if it doesn't matter where the money comes from, there are income requirements for that, quite simply. And it's to be fair to everybody that needs the services and everybody that pays for the services. So I felt like we had incredible testimony in our committee, probably 30, 35 people. If you didn't watch it, if you weren't there, then I encourage you to watch it. We heard, and really what the testimony did to me is it reaffirmed to me how generous our Medicaid program is in this state. And in reality, we have done more in this state for Medicaid than any of our surrounding states. And in reality, and data that was in the Journal of the American Medical Association in county-to-county spending by payer for healthcare, Indiana spends per recipient 3 to 4 times what's spent in Illinois in their same program. So there are going to be responsibilities that go with this. If you have this awareness that maybe your mail's not coming or that you're at risk of being off, then it's a two-way street. I think there are some responsibilities that the individual carries as well. And so the goal of this is to have a sustainable program that's available 8, 10, 15, 20 years from now. And not every state in the nation has expanded their Medicaid program. So I'm proud of the product that we've produced, and I want to keep it sustainable.
And I'll simply add to that, as your representative, either one of our offices would be glad to take your call and help you investigate the reason why. Is it the Postal Service or whatever has happened? And that's routinely what we have the opportunity to do.
There's another feature in that bill too. I don't know if you saw, but it's retroactive eligibility. I don't know if you saw that. So that if you do come off and then it's an error and you apply, there's a 30-day look back where the state's responsible for your care.
Okay, thank you. Next question.
I don't really have a question because all we get is rambling answers. I want to know how defunding the schools, the public schools, and defunding the libraries is going to help education in any way, shape, or form. and the $180,000 of our tax money that went to the luxury SUVs for the Secretary of State and the Lieutenant Governor, how is that helping our medical services? And speaking of medical, you guys get free health care. I think that that should extend to every citizen of Indiana at no cost to us.
Yeah, you're absolutely wrong when you talk about free health care. I have a high deductible plan that I pay for, no better than anybody else's health plan at all. In fact, I was on my wife's, but because of hers, I ended up on the state's. It's a good plan. I'm not complaining. I pay for it, but we have no Cadillac plan. If there is, they're paying big dollars for it. And so that for sure. Defunding the schools, that's a matter of how you look at it. I'm looking at funding on this sheet of paper here right now. Funding for schools are going to be participated. If we cut property taxes, they're going to be cut as well, because the local property taxes, I think Representative Barrett mentioned, is they're created, collected, and dispersed locally. The state, they never see the four walls of the state building at all. And so that is probably a third, somewhere in that vicinity of the funding for local schools. We can argue about school or parental choice, and that's a matter of in the eyes of the beholder. Can we do better? The answer is yes. The other piece of the puzzle that Representative Barrett mentioned, Indiana has a constitutional requirement that we cannot spend more than what we have coming in, and I'm grateful for that. I talked to a group of students yesterday from IU, the mother campus, and I said, look, what I'm trying to do is, one, I want to make sure that you guys have every opportunity to get the education you need, but we can't act and behave like the federal government. If we don't get that thing under control, it's going to affect everybody. So we're going to behave appropriately in Indiana constitutionally, and it has to be that way. I can't spend any more at home than what I have coming in, or I'm going to be in trouble. If I rack up credit card debt, all the interest, I'm in trouble. I have to live by it. The state has to live by it. It's simple. It's simple logic, I guess. And unfortunately, sometimes there are going to be things that happen that the state just can't do. Government is not the answer. Bottom line for me. We collect taxes and disperse them. Is it always appropriate or all kinds of different thoughts? Probably not. It's a difficult space.
I agree with Senator Raatz.
Okay, let's take our next question, please.
Thank you very much. I've come today to say that we really need to stop basing legislation on fear and on hatred. We told you last time that we needed to protect our education and our health care. Now, Jim Banks of Indiana is co-sponsoring a bill to return education to our states. Now, I wonder, since money for health care is so tight, where are you going to find the money to fund our schools without help from the Department of Education? You're terrified of diversity, equity, and inclusion being taught in schools, but your reasons are full of hatred and conspiracy. You cannot rewrite nor erase history to make yourself feel better. There are actions and there are consequences. History is there for us to share and inform our shared future. When you insist that diversity, equity, and inclusion is the source of the ills of our society, I can only conclude that you have allowed your discomfort to overcome your sense of responsibility as a lawmaker. Similarly, if you stand to the side and allow your colleagues to practice discrimination at the Capitol and at Washington while they inflict it on our communities, then you are not acting as a responsible legislator nor a human being. Thank you.
I answered that question the last time I was here, and I wouldn't change it. We can talk about a lot of things, but we talked about the 1619 project, right? I talked to a gentleman at a coffee shop in Richmond a couple of weeks ago. He overheard a conversation I was having and came over and interrupted me. He said, give me some time and I'll come back and talk to you. And so the history of the United States does have ugly spots, no doubt about it, whatsoever. Are we better today? That's the first question I have, and I think the answer is yes. Sorry, I believe it has been. But as I mentioned before, and here, you know, I opportunities, I don't know what else to do, honestly, when it comes to that. And I'll just leave it at that.
No, I just think, you know, there's different perspectives. Last time I think I talked about how I think my first year in, we talked about a hate crime bill, and you know, the push for that in my assessment was incredibly divisive. Some of these issues are wedge issues. They're divisive, and we try to take an approach on every Hoosier is treated equally and with respect. That's the way I try to live my life and raise my kids, and I'll stand by that if anybody knows me. So it's the golden rule. It's kind of what we're doing here. There have been Supreme Court rulings, federal changes. You can make that divisive, or you can make it equally appealing to everybody.
One last comment on the Department of Education at the federal level. I somewhat feel the same way. We are once you take amounts of money, the state of Indiana takes about $1 billion annually from the federal government for education. Can we live without that? No. Bottom line is, what I have advocated for, okay, if you close down the Department of Education, make sure you leave a skeletal crew that can still disperse those funds appropriately with accountability, that's fine. But once you get on $1 billion is about 1/20th of the state's income annually, right? And so we can't live without that. We need it, agree wholeheartedly. But I also would say they potentially could just have people who disperse that money, say this is how you use it, make the state accountable, and not have an incredible group of bureaucracy that we have to pay at that level too.
Thank you. Let's take our next question.
I'm going to go back a little bit to the last time we had a meeting. I want to apologize for the way I acted then. I was angry and mad. Today, I'm only angry. I'm not mad anymore. And what made me mad was when I left home last time, my wife said, "Don't say anything because you might get in trouble." I thought about that for an hour and a half before I spoke. And the more I thought, the angrier I became, because this is America. We should be allowed to say what we want without worrying about consequences. I also want to say I'm a lifelong registered Republican. I used to be proud of that. I am no longer proud of that. I think the Republican Party, I haven't left it, it has left me. Anyway, I have voted since 1960 in every election, national, state, and local, and I will continue to do that. I have a question for Dr. Brad. We used to have, a few years ago, no measles in this country at all. Now we have hundreds, we have 2 deaths, and we have 1 in Indiana. Do you recommend vaccine, which our national government does not?
You know, I appreciate your opening statement, and I remember the last thing. You're just passionate about what you felt at. I didn't feel there was any anger directed at myself. There's frustration now. There was frustration 6 months ago from a different group of people. You know, it's just the way it is. It's the pendulum swings. And so I don't think in any way or shape or form you're out of line. You're passionate about what you thought about. You know, I think our CMS HHS just came out and made a statement on advocating for the measles, mumps, rubella vaccine. I'm glad they did that. My kids are vaccinated. I'm vaccinated. I agree with the vaccination system. I think the big angst came over the COVID vaccine. You know, the average vaccine prior to that went through 15 to 20 years of study and clinical trials and safety testing and all. And I think people are looking at that vaccine like in a vacuum. It came when people were, I have a friend that lived in New York and he could see a hospital from his office window. Every morning there were body bags stacked out there. I mean, there's something that happened, and the government mass produced this product, and I think the jury's out on some of the newer vaccines, and I'd love to see them go through the same testing that, you know, that first 20 vaccines we've had in our history of our country. So I agree with the measles, mumps, rubella vaccine. My kids would get it. I'd recommend it to my grandkids. I'm glad the government came out and actually advocated for that. So thank you.
And let me just say, sir, I don't take offense to your comment that you felt like there would be some kind of retribution, but I can guarantee you from the two guys, including myself sitting at this table, that would never happen. I don't think in the state of Indiana it happens. That's what I can speak for what I know.
Yeah, I wonder about their future.
Not in my tenure. No, that's all I can say.
Okay. Thank you. We have time for one final question before we have to wrap up today, and that'll be this side.
There's a program that has been federally funded for, probably 6 decades, whose outcomes have shown to save money. And I am wondering what you personally feel about this program, and what is the state of Indiana going to do to keep this program, Head Start?
You may be aware of something that I'm not aware of, but I've investigated Head Start, and I'm not certain the federal government's talking about that right now, but I do think it would be a huge issue if they closed it down. To be frank about it, I'm a forward-thinking guy, and I actually had reached out to the federal government with the concept that just as the Department of Ed block grant that money to the states and let them run the Head Start program. And I'll clarify that by saying this. Any program, whether it's in the state of Indiana or the federal government, that's been run for 60 years has got some problems. I'm not talking about outcomes. I'm talking about the bureaucracy behind the scenes. And so I think the state could do a much better job. It's a very interesting question you have. I've looked into it just on a personal level with the concept I just shared.
Thank you.
I think it spills over to other stuff too. Anything that we're getting federal dollars from now, we're apprehensive. You know, that HIP expansion, there's $9 federal dollars for every state dollar that's invested in that. And, you know, if that goes down to $7 or $5, then it has an impact. We've developed this dependency on some of these programs. I think this is a wake-up call that anyone that's kind of lived long enough to work through a recession or a downturn economically has had the same thing in their own lives and in their own families, that you can't count on that, the healthiness of that paycheck. And I think we've gotten a wake-up call through this budget session that we got to do some things that we may not get the funding down the line. So it's been a true wake-up call in a broad sense.
Unfortunately, we are at 8:58 and our time for completion is 9 o'clock. I'd like to take this opportunity to thank all of you for coming out and participating today. We do not have time for more questions because we do have to be out of this space by 9:15 for the next program. Thank you for participating and engaging in this exercise of citizenship, but please do not let this be the last thing that you participate in. Democracy works best when we are all involved. So, thank you for coming out today. Please stay safe and have a wonderful day.